Good afternoon, and thank you for joining us for our webinar, Medicare and Employer Health Coverage, a Coordination Conversation. My name is Julia Goebel, Chief Marketing Officer at Benefit Express, and I will be your moderator today. This webinar will discuss coordinating Medicare with employer coverage and includes live Q&A throughout the session. Our speaker will be Larry Grugin, an expert in this area as well as others. With more than 35 years of experience in employee benefit law, Larry has a wealth of experience in dealing with qualified plans, health and welfare, fringe benefits, and executive compensation areas. Before we begin, I'd like to share a brief word about Benefit Express. We are a boutique firm with an ability to keep the client at the center of everything we do, and we don't take that for granted. We have a strong experience in our industry with over 19 years providing exceptional service to the over 3.5 million participants on our platform. We believe we truly have the best people and recruit from the benefit space so that they can add immediate value to each of our clients. And we provide full administration services to over 70 clients. So you can see we're not trying to be the biggest provider, just the very best. That's why we're responsible about our growth and have a 25% growth goal, which enables our service teams to partner with our clients for success. And it all begins with a successful implementation. And it's not just enough for me to say it. We like to share client perspective so that you can see what they can do. On our next slide, you'll see that we have done this again and again for large employers, including the one that you see on the screen, restaurant organization with more than 65,000 employees and 18,000 eligible, with a variety of services that are part of their assessment. And on the following screen, you'll see that we also serve healthcare systems as a core part of our area, following a merger, and this is all, part and parcel of the healthcare environment today. Finding a benefit administration solution that can support consolidated entities and harmonize plan designs, in one central hub is what we are known for. And so we are proud to serve many clients like the healthcare system on the screen, including it's more than 26,000 employees. And so with that as our brief commercial interruption, I would like to now turn it over to Larry Grugin to discuss Medicare and employer coverage. With that, Larry, please take it away.
And thank you very much, Julia. I appreciate it. Just to let you know how long I've worked with Benefit Express. I started with them when they had 4 employees. That was 17 years ago. So there's consistency, lack of turnover over there. So I think they're a good group of people to work with, and I've enjoyed working with them throughout the years. Now let's look and see what we're going to be talking about. And this area is extremely important because it's extremely complicated. And it affects many areas of your health and welfare practice. So what we're going to be talking about today is the Medicare secondary payer rules, Medicare Part D. We'll be talking about COBRA, and then other areas where Medicare will be affect your practice. And this is extremely important because over the last 10 or 15 years, more and more individuals are working past 65. So in this situation, more and more of your workforce are eligible for Medicare, and your HR department and other professionals are getting questions about how your coverage interacts with Medicare. And what I'm going to try to do today is go through some of the pinpoints that you can and cannot do, and when somebody is eligible for Medicare, and what you can in regard and how you interface with your practice. So let's go through this. The first thing I'm going to go through is the Medicare secondary payer rules. Now, generally for all of you here, what that means is that if you have over 20 employees, and if you have an employee, Medicare is secondary coverage, and your coverage is going to be primary. So here, can an employer in any way encourage active employees to elect out of employer-sponsored health coverage when they are eligible for Medicare? And the answer is no. The Medicare secondary payer statute prohibits a group health plan from taking into account the Medicare entitlement of an active employee and which is important, or family members, if such employees are considered to be in current employment status. Now, again, one of the fine examples of that is that many employers are now giving incentives to waive off of coverage. And you offer to all your employees, some employers are doing that. If you waive off coverage, you get so much dollars per month, $400, $500, $600 a month. Despite the fact that you're offering that to all your employees, you cannot offer that to those employees that are eligible. So it's the next bullet. Employers are prohibited from discouraging employees from enrolling in their group health plan or from offering financial or other incentives from an individual entitled to Medicare not to enroll. So even though you're offering it to all your other employees, you cannot offer that incentive to those employees that are eligible for Medicare. And again, this prohibition applies to employers. It doesn't apply to those employers with less than 20 employees. So almost everyone is subject to this prohibition. So what is current employment status? And this is extremely important definition. A person has current employment status if he or she is actively working as an employee. As the employee, including a self-employed person associated with the employer in a business relationship. Let me give you an example of that. You have an employee that is retired and they come back to work for you, either as a 1099 employee or some other capacity. That is considered to be in current employment status. So not only as an employee, but also someone other than that providing services for the employer. So please understand that. I've been helping with litigation when employers don't realize that, and they bring former employees back in certain capacities and they don't offer them coverage. So they're covered by Medicare or they're covered by a retiree coverage. Well, you got to be real careful in that regard because the CMS will see that as being in current employment status. That's extremely important to understand. So let's look at the next question. Can an employer drop employees or dependents who become disabled from an employer-sponsored coverage when they become eligible for Medicare if such employees are considered in current employment status? And again, the answer is no. The Medicare Secondary Payer Statute prohibits a group health plan from taking into account the Medicare entitlement of disabled employees or a family member. Otherwise, covered an individual isn't actively working is necessarily considered in employment status if he or she is receiving disability benefits from the employer for up to 6 months or retains employment rights in the industry and has not had his employment terminated by the employer. So this could be somebody, for example, that's in family medical leave and receiving disability benefits. All right. This prohibition does not apply to employers with less than 100 employees. So again, everybody here is subject to that requirement. And before going on to the seminar, somebody asked me, they said, well, what we want to do is remove employees' spouses that are eligible for Medicare, and you cannot do that. Now, again, under ACA, an employer is not required to cover spouses. And many employers are doing that. They're removing spouses, but you cannot divide up the population of the spouses and say, well, if you're not eligible for Medicare, we're going to cover you, but if you are, we're not going to cover you. You cannot do that. So who is considered a disabled individual under these rules? Disabled individuals generally are those who are under age 65 and who have been entitled to Social Security disability benefits for 24 months. Which employees are counted in determining the number of employees for the small employer exception? Basically, anybody in your control group. It includes leased employees, anybody in affiliated service group, or under code section 52 is if you have a 50% interest. So basically, they're looking at all your, in a control group basis, all your employees. So what does it mean to take into account Medicare entitlement? Under the statute, a group health plan may not take into account age-based Medicare entitlement of the individual who is covered under the plan by virtue of current employment status. And remember, what we're not talking about here is retired employees. Under retired employees, the retirement benefit can be secondary to Medicare. There are some famous cases about 10 or 15 years ago that said that there's no problem, you can do that. So these are employees that are in current, they're either providing services as an employee or as an independent contractor. Or a disability-based Medicare entitlement if an individual who is covered under the plan by virtue of the individual's current employment status. And again, we're not talking about retirees here. So a plan must provide current employee or a current employee spouse who is, say, 65 or older with the same benefits under the same conditions as provided to employees and spouses who are under 65. So in my example, if you had an employer that said, we're not going to cover any spouses under the plan, there would be no problem. But you cannot say we're not going to cover those spouses that are eligible for Medicare or 65 or older. You cannot do that. And again, here are more examples of employer-insurer actions that constitute impermissible taking into account failure to provide primary benefits, offering coverage that is secondary to Medicare for those who are entitled to Medicare, terminating coverage because the individual has become entitled to Medicare, denying or terminating coverage because an individual is entitled to Medicare on a basis of disability without denying or terminating coverage, or imposing limitations on benefits for Medicare entitled individuals that don't apply to all others that are covered under the plan. So basically, you cannot take into consideration for any purposes, either cost-wise or coverage-wise, eligibility for Medicare. These are more, you can't charge individuals higher premiums, requiring Medicare entitlement to wait longer for coverage, paying providers to suppliers for less than for services furnished to Medicare beneficiaries, providing misleading or incomplete information, including in its health insurance cards, claim forms, or brochures distributed to beneficiaries, providers to supply instructions to bill Medicare first, or refusing to enroll an individual for whom Medicare would be a secondary payer when enrollment is available to similarly situated individuals. So you cannot target those individuals that could go on to Medicare. So what are considered incentives under these programs? Employers are prohibited from discouraging employees from enrolling in group health coverage or from offering any financial or other incentives for an individual entitled to Medicare not to enroll. And again, my example really applies. Many employers are telling employees if you have coverage someplace else, you can take cash and waive out of our medical coverage. You can do that, but you cannot offer that cash benefit to those eligible for Medicare. You cannot do that. And again, this prohibition, this second bullet here, applies even if payments or benefits are offered to all other individuals who are eligible for coverage under the plan. So you got to be real careful when you start offering cash incentives to waive out of coverage. Can Medicare or Medicaid premiums be reimbursed by an employer for active employees? And there's a couple of I think important exceptions here. For small employers, they can either use a note, follow the procedure under notice 2015-17, or a small employer can use a qualified small employer, HRA. Now in 2020, there's a new device called an individual coverage HRA, which is very interesting because that's an exception, and both large and small employers can use it. But what you as a large employer, suppose you have a location What you could do is create that, not offer group health coverage to those individuals, and offer an individual coverage HRA, and again, pay for Medicare premiums. And that's okay. There's no Medicare secondary payer rules, but you got to be careful. You have to meet certain rules. But that's the large exception that was just offered last year, starting offered this year. This is the first year. So an individual coverage HRA, but you cannot create a group under the individual coverage HRA, which is just targeting those eligible for Medicare. Since many of you are not small, I'm not going to cover this slide. I just understand if you're under 20 employees, you could again use an HRA to do that. These are some of the rules. I'm not going to cover that. And again, for qualified small HRA, these are HRAs that are sponsored by those employers under 50. But again, one device you can use if you're going to do that is an individual coverage HRA. It can be used by both large and small employers. Eligible employees for this benefit cannot be eligible for group health plan. You cannot target just employees eligible for Medicare. Must meet group and benefit requirements. And to avoid violation of Medicare secondary payer rules, you can't just reimburse Medicare premiums. That employee must be allowed to use it for other purposes, like other premiums or other medical expenses. But again, that's out there. Are there any special rules for employers that participate in multi-employer or multiple employer plans? Yes. In regard to age-based Medicare entitlement, the Medicare secondary payer statute provides that if at least one employer in the plan has 20 employees or more, then the whole group is subject to the Medicare secondary payer rules. However, the plan may elect not to have age-based rules apply to those employees that have fewer. A different rule applies to multi-employer plans. These are union plans and multiple employer plans under a disability-based Medicare entitlement rules. Under these provisions, if any one employer in the plan employs 100 or more, then at least 50% of the regular businesses the previous year, the plan will be considered to be a large employer. So again, if you're under either a multi-employer plan or multiple employer plan, there's some special rules. Are there any special rules for end-stage renal? Here, a group health plan cannot take into account the individual's end-stage renal-based Medicare eligibility for the first 30 months. Medicare must be secondary for the first 30 months, and then after that, they're going to be primary. That applies also for COBRA situations. Now, over the past 10 or 15 years, there's now Medicare Part D drug plans. And the question I always get, and this is the important question right here, does an employer prescription drug program have to be coordinated with the employee's Medicare Part D? And the answer is yes. So the Medicare secondary payer rules are triggered when the individuals who enrolled in group coverage offering are also enrolled in Medicare Part D. Under here, Medicare Part D plans and group health plans are generally required to comply. So again, if you have 20 or more employees in that situation, 65, then your plan would be primary and Medicare would be secondary. Now, one question despite all these rules and what an employer can do in this situation, as an employee at any time can elect out of your coverage and elect Medicare. There's no problem with that. So if you want to show an employee by electing Medicare and going through either an Advantage plan or Medicare Parts A and B, whatever, the costs involved, the coverage involved, and show them what the differences in the coverages between yours and Medicare, and show them what the cost differences are, that's no problem. You're not encouraging or discouraging, you're just giving them general information in regard to that. So there's nothing preventing an employee electing out of employer coverage on his or her own. So at any time an employee can do that. Now, if you're offering health FSAs, HRAs, and HSAs, which plans are subject to these rules? And again, health FSAs, HSAs are not subject to the Medicare secondary payer rules. HRAs are, they're subject to that. Individual coverage HRAs are a special exception. And CMS has indicated that for Medicare secondary payer rules, health FSAs as well as HRAs are not group health plans. But group health plans subject to Medicare secondary payer rules, information about should be reported to CMS in the same manner. So HRAs are subject to the rules. Health FSAs and HSAs are not.
Great. So I want to use this opportunity to remind all our attendees that we have a question box that you can chat a question into, and then we will read it aloud. I have a question from Carol C., who writes, we have a medical waiver incentive plan that is offered along with our medical plans for all employees. If the employee, either via new hire or during open enrollment, elects the waiver plan, would this be acceptable for those over 65?
No. As I indicated, no, just because you offer it to everybody doesn't mean it's deemed to be an incentive to waive off. That's a very common question, because employers say to me, well, we're offering it to everyone. What's the big deal? The big deal is that those that are eligible for Medicare, you are subject to the Medicare, and you cannot give, and that's why I think it's important to understand, you cannot give any employee an incentive that's eligible for Medicare to waive off of your coverage and onto Medicare, and giving a cash incentive to waive off would be a violation.
Thank you for that clarification. Okay, great. And then that's
the most important question I get. There's all kinds of misunderstandings.
So if you learned one thing today, folks, that's the one. Yeah. Very good. And then related to the prior slide with FSA and HSA, the question from Dawn M is, so an FSA and HSA could be used to supplement premiums, yes or no?
Well, a health FSA cannot. A POP plan can now. A POP plan can. But the problem with that is Medicare is not considered to be group coverage. So you could use an individual coverage HRA to do it, but there are some issues with using a POP plan to do that. You got to be real careful in that regard.
Thank you. That's the last of our questions for now.
So the bottom line is, if an employee continues to be covered under the employer plan coverage, will he or she be penalized when he or she decides to elect Medicare? And the answer is no. So it's extremely important that an employee enrolls in Medicare during his or her initial enrollment period. If she does not, then he or she is subject to late charges and premium surcharges. The Part B premium goes up 10% for each 12-month period for an employee who was eligible but did not enroll. Now, there's a special exception. The employee may enroll in Part B or Part A at any time if he or she is covered under another group health plan. But, however, the employee may choose to wait and enroll during a special 8-month period. So, in layman's language, what this slide is trying to say is that if you are age 65 and decide to continue on your group employer coverage and not enroll in Medicare, you're not going to be penalized. But once you terminate that coverage and you retire, then you have a special enrollment period. You have 8 months to enroll in Medicare without penalty. So this special period would start from the month that the employee or his or her spouse stops working, or when he or she is no longer covered by the plan, whichever comes first. So again, if you retire at 68, you can enroll and you're covered by an employer plan. You have 8 months from the date you lose coverage to enroll in Medicare without. You have a special, what's called a special enrollment period. Now, please remember, and I'm going to go through this in the next few minutes, is the fact that COBRA is not considered to be, for this purpose, employer coverage. And the 8-month period starts ticking as soon as you enroll in COBRA. It's not considered to be employer coverage. So please, that's a big misunderstanding that many people have. So again, COBRA is not considered to be employer coverage. And again, if you decide to enroll in COBRA, take it for 18 months, the penalty that you see on slide 29 will apply to you. So please remember that. And many times people may not want to enroll in Medicare because they're contributing to their HSA, so they want to continue to contribute to their HSA. And if you're covered by group coverage, no problem. And there's a special rule that applies for HSAs. I will cover that in the next few minutes. But again, be very careful in that regard. Once you lose employer coverage, you have 8 months to enroll in Medicare without penalty. Once a retiree becomes eligible for Medicare, can retiree coverage be coordinated with Medicare? And again, there was a very, very important case about 10 or 15 years ago. And the EOC provided final regulations that allows employers to provide retiree coverage to continue the long-standing practice of coordinating the benefits with Medicare without violating the Age Discrimination and Employment Act. So what this is trying to say, once you are, let's say you retired at age 63, many employers continue that individual in active coverage. Once they reach 65, their retiree coverage then turns into supplemental coverage, and that coverage is then coordinated with Medicare. And again, there was a very famous case about 10 or 15 years ago, and basically what was ruled in federal court that, again, coordination with Medicare at age 65 is not a violation of the Age Discrimination and Employment Act. Employers can do so. So again, most employer coverages, once the retiree reaches age 65, is then that retiree coverage is in supplemental coverage. Now, something to remember, there are penalties involved if an employer is found to be in violation of the Medicare secondary pay rules. And what's important is that CMS works with IRS to assess these penalties. And the IRS, because I've had a couple of clients get penalized, and they hire law firms across the country to collect the fees in regard to this. So the federal government and the Medicare recipients are authorized to recover double damages from the group health plans that treat Medicare as primary in violation of the rules. Violation of the financial incentives prohibition is subject to a civil penalty of up to $5,000 for each violation. Code Section 5000 imposes an excise tax of 25% of expenses of all employers other than certain governmental agencies and employer organizations whose group coverage failed to comply with Medicare secondary pay rules. And employers or employer may appeal that determination for failure. And the government has 3 years to collect health care payments that were wrongly paid by Medicare from the primary party. So if you get a letter from CMS indicating they want payment because they paid it and your plan didn't, you could be subject to these penalties. Is there any reporting requirements? Now, which is very interesting, it's under Section 111 of the Medicare and Medicaid Extension Act. New mandatory reporting requirements were added for group health plans and non-group health plans, liability insurance, that you have to report which individuals working for you, and this is how they check to see whether you're in compliance with Medicare secondary payer rules. Now, who is required to report the mandatory reporting? This responsibility for reporting information to identify whether a group health plan is primary to Medicare falls upon the entity serving as an insurer or third-party administrator for the group health plan. CMS refers these entities as responsible reporting entities. What types of plans are subject to this? Well, many types of group health plans are. Health FSAs and HSAs are not, but HRAs are if they pay a benefit of $5,000 or more. And individual coverage HRAs can be subject. So if you have an HRA that pays $5,000 or more in benefits, you have to report this. And again, now here's the issue and problem with this reporting. I've had many employers question this. It's very easy to determine whether an employee is eligible for Medicare. What's going to be tough is understanding and knowing if any of their dependents, both children and spouses, are eligible for Medicare. They could be eligible for Medicare for disability. So again, if any person in the family is eligible for Medicare, you are then has to report this. What information should be reported to CMS? CMS must be provided information regarding all individuals, meaning the definition of active covered individual. In general, an active covered individual is anyone who may be Medicare eligible and currently employed, or a spouse or other family member of a worker who is covered by the employer's individual's covered group health plan, who may be eligible for Medicare and for whom Medicare would be a secondary payer. So you, as an employer, have to find out if any of the dependents could be eligible for Medicare. For mandatory reporting purposes, CMS has defined active covered individuals in the user guides to include these. Any individual who are ages 45 to 64 with coverage based on their own or family member's current employment status, are age 65 or older and coverage based on their own or spouse's current employment status, having kidney dialysis or have received kidney transplant, or are under age 65 and are known to be entitled to Medicare and have coverage in the plan based on their own or family member's current employment status, which means it could be a spouse or it could be children who are receiving Medicare because of receiving disability benefits. Remember, now you're covering children up to age 26. That could be an issue. How and when should information be reported to CMS? Information may be submitted only through electronic process or under group health plans. These entities will register online through a secure website. Once the data is submitted, CMS will work with the submitters to set up data reporting and response process, and this information must be reported on a quarterly basis. What are the penalties for failure to comply? There's a penalty of $1,000 per day for entities who fail to comply with this requirement. This fine is in addition to any other penalties under Medicare secondary payer rules. So please, make sure you're doing this reporting. Julia, do we have any other questions?
We do. So I'll start with a CMS plan question. So this is from Suzanne, who asks, CMS states plan year for reporting purposes. Is this for renewal year or plan year? For example, a group renews in July, but the plan year starts in January.
I think it would be the plan. I think it would be the plan, because I think it would be
plan
the
year.
Plan year. Yep.
That would be my read on that as well. Thank you. Now here's a question about if a member on ESRD becomes Medicare eligible after a 30-month wait period, can employee refuse to cover them on group plan and require as they transition to Medicare as primary? And I think that might be 30-day wait period.
Yeah, I think it's 30-day wait period.
Yeah.
So in that situation,
can the employer refuse to cover?
I don't understand. I'm sorry. Could you repeat the question, please?
Of course. Yeah. So if a member becomes Medicare eligible after a 30-day wait period, can the employer refuse to cover them on the group plan and require that they transition to Medicare as primary?
Yes, they can. They can say we're only going to pay secondary. If they don't refuse coverage, they say that any other coverage would be then because under the kidney dialysis, after 30 months, the employer coverage is secondary. I had a case like that just a few years ago where because the way the statute reads is the fact enrolled or eligible to enroll. So if that employee is eligible to enroll and refuses to enroll, you as an employer, you cannot refuse them coverage, but you then just pay secondary.
And just a clarification, so that the ESRD waiting period is 30 months with an additional 3-month period. Hope that is helpful. Okay. Let's see. I've got a couple of questions related to COBRA coverage, which I think we're covering later.
We're going to cover in a few minutes.
Yeah, we'll return to those questions then at that time. Thank you. Let's continue.
Okay. So let's look at the special obligation under Medicare Part D. So for those employees who are eligible for Medicare Part D benefits, what disclosure must be provided to them? And each year before October 15th, an employer provides a notice to those individuals to tell them whether their coverage is either credible or non-credible. Now, this is important, and I get a couple questions in regard to this. The reason why it's going to be provided before October 15th is because it is before the open enrollment for Medicare. So that employee has to know whether your employer Part D coverage, your prescription drug coverage, is credible. Because if it is not, then they have to enroll in another Medicare Part D program. Now, the question I get all the time is, well, when before October 15th can you give it to them? And the answer is, it doesn't indicate. So can you give it 6 months before, 10 months before? And the question is, there's nothing that indicates you can't do it, but the question is, in the meantime, does that coverage change during the period of time after October 15th? So you always have to give the notice before your coverage changes. So in other situations, must be the notice be provided prior to the individual's initial enrollment, prior to the effective date of any Medicare Part D that enrolls in the prescription drug program. So if your enrollment period is not calendar year, you must make sure that you give another notice before the next open enrollment. That's what I would do. Also, you have to give it whenever the employer is no longer offers drug coverage or changes it so it's no longer credible. So again, if your enrollment is different than calendar year, always make sure you give another notice before your open enrollment. And also you have to give it out before the request by Part D eligible individuals. Why does the employer have to give this coverage? And I alluded to this before. Because that individual must know whether your coverage is credible, because if it's not credible, then your employee has to enroll in their credible coverage, and if they don't enroll in credible coverage, there could be a late enrollment penalty. They could be assessed. So here, what's interesting, it is the employee that's penalized, not the employer. So again, be very careful, because if you mess up the notices, it's not you, the employer, that gets penalized. It's the employee that gets penalized. So again, so the late enrollment penalty may apply after experiencing a lapse in credible coverage for any continuous 63-day periods or longer at any time after the end of the initial period. The penalty amount will be the base beneficiary premiums that would be otherwise applied would be increased, but a greater the amount that the CMS determines actuarially sound for each uncovered month and the same continuous period, or 1% of the base beneficiary premium. So again, it's not you, the employer, that's being penalized. It's going to be the employee that's going to be subject to this late enrollment penalty. So are there any penalties if the employer either does not provide the notice or provides the incorrect notice to employees? There's no penalties on behalf of the employer. Remember, it's the employees that are going to be penalized for not having a credible coverage Part D program. So please understand that. Are there any other disclosures that the employer must make under the Medicare Part D? And group health plans must notify CMS about credible coverage status. Disclosure to CMS that must be used to disclose to CMS whether the group's coverage is credible. It's through the CMS website, electronic. There's one exception. Entities without internet access can request copies of the disclosure to CMS be faxed to them, presumably for a completion and return to CMS on hard copy. Notice must be given 6 days after the end of the plan year. So again, CMS will know whether your coverage, and the reason why they want to know this, because they can penalize the employee. Julie, are there any other questions? Guess there's not. So let's go on to COBRA and Medicare. Now this area is extremely complicated. And there's various situations where Medicare will, again, terminate COBRA coverage. Other times it extends it. So please understand and please go through these rules very carefully. Say, let's go through this. When can entitlement to Medicare terminate COBRA coverage? And what this slide is trying to say is if any qualified beneficiary, including the covered employer, first becomes entitled to Medicare after electing COBRA coverage, his or her COBRA coverage can be terminated early. Now, what does entitled to Medicare mean? It means being enrolled. So you have to enroll to be entitled. Now, just because one family member enrolls in Medicare doesn't mean it cuts off the other family members. So you as an employee become enrolled in Medicare, and your family members who lost coverage are on COBRA, they can continue to receive COBRA in that situation. When does the entitlement to Medicare extend the period of COBRA coverage? If you enroll in Medicare before enrolling in COBRA, that extends. So as this slide indicates, when a covered employee's qualifying event, termination of employment, occurs within the 18-month period after the employee becomes entitled to Medicare. So you become entitled to Medicare and then you get COBRA. The employee, spouse, and dependent children, but not the employee, become entitled to COBRA coverage for a maximum period of 36 months. The employee remains entitled to the basic maximum period of 18 months. And again, this is important for the employees to understand the various rules in regard to this. So this is where the employee enrolls in Medicare before they are eligible for COBRA. Does the entitlement to Medicare before electing COBRA terminate COBRA coverage? And the answer is no. So COBRA offer cannot be withheld because of Medicare entitlement. And entitlement means enrolling in Medicare. Now, is entitlement to Medicare ever a first qualifying event to trigger COBRA? And the answer is, it is not an event for the employee, but it is for the spouse and dependent children. Because in most plans, because of the Medicare secondary payer rules, they cannot drop somebody from coverage just because they've enrolled in Medicare. But you could have a situation where an employee drops coverage and they drop his or her family because of entitlement to Medicare. In that situation, you don't offer COBRA to the employee because it's a voluntary act, but you offer it's a qualifying event for the spouse and dependent children.
So I do have several questions on COBRA from our listeners. So would you like to continue walking through the COBRA section and then we'll cover at the end?
Sure, why don't we do that?
Sounds good.
Well, Enroll in Medicare preserve the employee's special enrollment rights under Medicare. As I indicated before, COBRA is not considered to be group health coverage. So remember, when you terminate employment and you're over age 65 and you're covered by employers' group coverage, you have an 8-month special enrollment period to enroll in Medicare without penalty. Just because you enroll in Medicare doesn't stop the ticking of the 8 months. So please advise your employees, once they terminate, they have 8 months to enroll in Medicare without penalty. That's what that slide is trying to say. Now, must a plan still offer COBRA coverage to retirees when alternative retiree coverage is offered? And this is important. Many people don't understand this. Let's say you have a retiree medical coverage. And when a person retires, they get that retiree coverage. Now, when that person retires, you don't offer them COBRA because you offer them this retiree coverage. But many times, retiree coverage may end at a certain time in the future. If you didn't offer COBRA at the time they retired, you have to offer it when that retiree coverage ends. How can you avoid that situation? When somebody terminates, what the law says is if there's any difference in the retiree coverage, which means cost or coverage, and many times there is, because the fact many times a retiree will pay more for coverage than an active employee, the government sees that as a loss of coverage. And if you want to cut off a retiree's eligibility for COBRA, you give them a choice between COBRA and retiree coverage. And if you do that, when your retiree coverage ends, you don't have to offer COBRA. And again, must a plan offer COBRA to retirees when alternative retiree coverage expires? And again, it depends at the time of termination whether you offer that employee COBRA. And you can offer to them if there's considered to be a loss of coverage. That's what that slide is trying to say. Okay, why don't we go through the COBRA questions?
Sounds good. Okay, let's talk about a question from Laura N., who writes, if an employee enrolls in COBRA upon COBRA eligible date with an employment termination and is Medicare eligible, but does not enroll in Medicare once they lose active coverage, and then later enrolls in Medicare, will they need to cancel COBRA or can they keep both?
No, Medicare technically cancels. Once you enroll in Medicare, it cancels COBRA coverage.
Great, thank you for that answer. And let's read a question from Brenda T. If an employee is terminated at an age over 65, is an employer required to offer COBRA? If
yes.
COBRA is offered, so yes, they are. First two-part question. So they are required to offer COBRA. And then the second part of the question is, if COBRA is offered and the former employee enrolls, would they be subject to the late enrollment penalty at the end
yes.
of 18 months?
Yes.
Also, yes. Okay. Thank you for that. Sounds like.
And that's important. I think
clarity.
that's a real important fact to really, if you have anyone who is age 65, is to let them know a fact of that 8-month period. It's extremely important.
Mm-hmm. Thank you. Okay, and I'm scanning for another COBRA question. I believe we've covered COBRA-related questions. Here's one that is more generally in nature related to turning 65. If we offer retiree health, can we as the employer stop coverage at age 65 when they are eligible for Medicare?
Yes, sure.
Okay.
But many employers do in that situation is because remember, the Medicare secondary pay rules only apply to active employees. It doesn't apply to retirees.
Mm-hmm.
So again, retirees are, the problem is going to be if that person comes back and works. That's when the Medicare secondary pay rules come back again.
Mm-hmm.
All right.
And let's continue.
Let's continue. HSAs. HSAs, basically what it indicates on this slide is when is an individual no longer eligible to contribute to an HSA? It's the month they enroll in Medicare. So whenever they enroll in Medicare, then they are it's not age 65. I get some people say, well, age 65, you can no longer contribute to an HSA. No, that's not that. It's when you enrolled in Medicare. Now, a very common situation, let's say you have an employee and their spouse. And the employee and their spouse have group coverage, they have family coverage. And let's say the husband enrolls in Medicare, continues the group coverage. In that situation, he is no longer eligible to contribute to an HSA, but monies can be put in for his spouse and she could contribute at the family level. Please understand that. So again, once you enroll in Medicare, you're not eligible for HSA contributions, but if you have a spouse, those family HSA contributions can be made to her, the spouse's HSA. Okay? So again, it is not being eligible for Medicare, it's being enrolled in Medicare. And if you're not receiving Social Security benefits, enrollment in Part A is not automatic at age 65. But if you start receiving Social Security benefits at age 62, then yes, enrollment in Part A is automatic at age 65. Are there any special rules if an employee enrolls in Medicare after age 65? I run into this very frequently. In Information Letter 2016-82, the IRS indicated that HSA holders cannot make contributions for months for retroactive Medicare coverage. This is because Medicare coverage typically begins with the month the individual turns 65. But if the actual commencement date depends on when the individual applies for Medicare, either Social Security or retirement, individuals who delay applying for free Medicare Part A are covered retroactively to the month that they to age 65 or 6 months, whichever is less. So if somebody enrolls in Medicare at age 68, they will go back not to age 65, but they will go back 6 months. If that person put in a full year's contribution, they're going to have an excess contribution for 6 months. So please let your employees know if anybody is older than 65, enroll in Medicare and are contributing to an HSA, they're going to have a rude awakening when they enroll for 6 months under Part A. And because of that, that makes them ineligible for 6 months to contribute to an HSA. So the IRS explained that the code sets a 0 contribution limit for months of Medicare coverage, and the rule has no exceptions. So months of retroactive Medicare must also reduce HSA contributions. Extremely important. So as a result, an HSA holder who overcontributes because of retroactive Medicare coverage can be subject to a 6% excise tax unless the excess contribution and earnings are withdrawn by the federal tax filing date. So for 2019, it's April 15th, 2020. And it's the responsibility of the employee to take that money out because, again, for each year it's sitting in there, they're going to be subject to another 6% tax. And again, can an HSA be used to reimburse individual Medicare premiums? And the answer is yes. But the HSA holder must be, again, at least 65. So if you are 63 and your spouse is 65, you cannot reimburse that older spouse for their Medicare premiums. They can be reimbursed for Part B, Part D, but they cannot be reimbursed for supplements. So please understand that. And as this says, the final third bullet, HSA generally cannot be used by retired account holders for their health coverage premiums prior to age 65, with the exception of COBRA. And is Medicare coverage considered to be credible coverage for HIPAA purposes? Medicare is subject to HIPAA certification requirements under the Public Act and thus count as credible coverage, but they are not otherwise subject to the portability rules, special enrollments, and all that non-discrimination. Are there any additional questions?
We do have a couple of questions related to HSAs. So once an employee is enrolled in Medicare, can an employer still make HSA contributions?
No, they're not eligible.
No longer eligible. Thank you. And related, when does an employee have to stop making HSA contributions before Social Security income benefits begin?
Well,
or Medicare benefits as well.
It is, they cannot contribute in the month they are enrolled in Medicare. So Medicare begins the beginning of the month. So the beginning of that month that they're eligible, they are enrolled in Medicare, that's the month that they cannot contribute to an HSA.
Thank you for that. If an employee is enrolled in an HSA medical, the rules say the owner of the HSA cannot be enrolled in another medical, even Medicare. Is that correct, is the question?
Well, it is, once you enroll in Medicare, you can use your HSA contributions, but you cannot contribute to the HSA. So once you enrolled in Medicare, then you can no longer make HSA. But again, you have to explain to employees, if you have a married couple and one is eligible and one is enrolled in Medicare and the other one isn't, all the HSA contributions can go in the other spouse's HSA. As long as they're covered under a family coverage, then the family coverage limit applies to that one individual.
Thank you. And scanning, as we are in our last couple minutes, scanning just for an additional question or two.
Sure.
What is the deadline for Medicare to send 1095B forms?
It would be the same limit, the same as the C's. They have to do it. I think it was February 28th. I think the B's. I think you have to get a B by that date.
If an
Or
employee
no, it's
opts
not
out of
February 20.
Medicare,
It's March. I'm sorry. I think it's March 3rd. I'm sorry.
yes, yeah, there was a change in the
Right, it's March 3rd.
1095.
Right.
Yeah. Okay. If an employee opts out of Medicare Part A, the employee and the employer can still make HSA contributions. Is that correct? They
Sure,
opt
as
out of
long as they're
Medicare
not
Part
enrolled,
A.
as long as they're not enrolled, sure, they can make HSA contributions.
Thank you. And those round out the majority of our questions. I have one last one, and then we'll adjourn for the afternoon. Some HMO group plans continue to pay primary for groups for retirees. Do the retirees still have to have Medicare B?
Yes, I think they would probably have to. If the Part D coverage is credible, no, they don't have to enroll. As long as they have coverage, pharmacy coverage that is credible, they don't have to do so. But the plan has to, again, give a notice to the employees to see if their pharmacy benefit is credible coverage under Part D.
Thank you. At this time, I want to thank all of our attendees for joining us today and for your many questions. I hope this added to your enjoyment of the webinar. And certainly, our contact information is listed on the next slide. If you have any questions for myself, Benefit Express, or for Larry, please reach out to us and let us help. The slides, as well as a link to a recording of the webinar, will be provided in the next 1 to 2 business days. And also, please watch for our future webinars. You can always see them by going to benefitexpress.info. Thank you once again. This concludes our webinar for today.
Take care, everyone. Bye-bye.